Just a week ahead of the first COVID-19 vaccination starting in South Korea, facilities top of the priority list, like nursing homes, are gearing up to be ready for their special deliveries. In the coming hours, the South Korean government will lay out the specific timeline of who will get the shots and in what order. Choi Jeong-yoon reports.
South Korea is gearing up for next week's rollout of COVID-19 vaccines. First in line are the workers and patients of some 5,000 nursing homes and care facilities across the country. The government will finalize a detailed list by Friday. Originally, everyone working for or admitted to such facilities were scheduled to get the shots. But regarding concerns over the efficacy of AstraZeneca's vaccine on the elderly, the government has decided that vaccinations for those over 65 years old be put on ice for the time being. Other vaccines like those made by Pfizer or Moderna are under consideration for the limited age group, and the government expects them to arrive as early as April. Here's how the vaccines will be administered. Based on the list finalized on Friday, the task team will decide by next Thursday when the vaccines will be delivered and how they will be given. The first inoculations will come between this month and March, and the second round from April to May. For nursing hospitals where there are doctors, inoculations will be carried out on site. But special staff will visit care homes for the elderly. Heading into March, workers at general hospitals and response staff like quarantine and contact tracing workers will receive their first shots. To make all this process successful, South Korea is conducting another simulation of its vaccine rollout. The Defense Ministry is leading the drill alongside the police, Transportation Ministry, the Korea Disease Control and Prevention Agency, local clinics, and delivery companies. The exercise begins from a vaccine factory in the city of Andong in North Gyeongsang-buk-do province and moves to Gyeonggi-do province for distribution centers where the vaccines will be split up and sent to local clinics and vaccination centers. The mock-up will test transportation routes to 25 clinics nationwide, including to ones on the islands of Jeju and Ulleungdo. Choi Jeong-yoon, Arirang News.